Hi there, and welcome to another episode of the Heart to Heart series. In the episode today, we're talking about what about the children? I am Deitra and I am the founder of Circle Health Coaching LLC. And I'm also the heart health coach to Black women who value, own, and invest in their health. I empower them with evidence based and culturally relevant lifestyle interventions that support them on their journey to optimal heart health. Well, here at Heart to Heart, it's like a girl talk, really and truly a girl talk, where we talk about the heart from the heart. And we do that over a glass of what we call our red wine, but it's non alcoholic and it's hibiscus tea. Because of the heart health benefits, it relaxes the blood vessels, therefore lowering the blood pressure. So that is why we choose that drink during our girl talk. So before we get into the content, I want to invite you to subscribe to the YouTube channel, like the video, and click on the notification bell so you're alerted when a new video is posted. Share this with someone who you feel could benefit from the information that I share. And lastly, this is Girl Talk, so I would love to see the comments below so that you talk to me, I talk to you, and it's a conversation, a dialogue in the comment section. So as we now get into the content, I'll ask you to pour up your red wine or your hibiscus tea and cheers to you. And let's chat it up about what about the children? So, if you have been with me for some time now, you know we just completed a 6-part series entitled A New Legacy Loading because we want to create a new legacy of health for our community, right? For ourselves, for our family, and for our community at large. And so, as we wrapped that up last week, I started thinking about, well, what about the children? Yes, we want to be an example for them, but what about them? What are we going to do for the children? And so, you know, again, if you've been here anytime, you know I love music. So the song that came to mind was by Yolanda Adams, the gospel singer, What About the Children? And then from this book that I read, and you probably read it as well, there is a passage that it says, and if you see me looking down, I am looking at my notes. And so what it says is that teach the children, I lost my train of thought here. Teach the children how they should live, and they will remember it all their life. You may have heard it like this: train up a child in the way that they should go, and when they get old, they will not depart. Does that one sound familiar to you? Yeah, so I was really thinking about that, and I know that that passage is really about the wisdom principles. But what if we applied that to health principles or healthy lifestyle as well for the children? What are your thoughts about that? I would love to, see your response in the comment section below. But again, as I thought about that, because listen at the statistics. We talked about the state of Black women's health, but I want you to, just think about the children, what is going on with them. And you really think heart disease, you think adults or even older adults. But listen at these numbers here about the children. So again, I'm going to be reading from my notes. So research shows that the underlying risk factors of heart disease can begin manifesting during childhood. During childhood. So one in 3 kids are overweight or obese. 1 in 5 teens have high cholesterol and are having to be placed on statin medications. We shouldn't have that. And then atherosclerosis, which is the buildup of the fat and cholesterol plaques inside the artery walls, as well as hypertension. Listen at this, begins manifesting by ages 5 through 8. The babies are just getting started with life, starting school, and having atherosclerosis and hypertension. We have to think about, what about the children? So why is that those numbers so staggering? Well, that study went on to say that 99% of children eat unhealthy diets. So 3 in 4 children consume excess saturated fat, like your pizza and things of that nature. And we can create a healthier way for the pizza or a lot of fried foods. We can do a little bit better, which we talked about, in the 6-part series that applies to the babies as well. The other one is that 9 in 10 eat too much sodium. Again, when we talked about the lifestyle choices, you can apply all of those same tips and steps, apply those lifestyle choices with the children as well. And the last part is that just 2 in 10 kids eat 5 daily servings of fruits and vegetables. We can change the narrative. We talked about that in the 6-part series. We can also change the narrative for our babies. What about the children? And so again, if you've been here any time, length of time watching the videos, I love using quotes. And so 2 quotes also came to mind. So one, remember we talked about training up a child or teaching them, how they should live, and they will remember it all their life. Listen at these 2 quotes and tell me your thoughts. One, kids don't do what you say, they do what they see. So how you live your life is their example. So if you have followed those 6-part series, are you now living the life that you want them to live? Comment in the section below. And then the other quote that comes to mind, children do learn what they live, and then they grow up to live what they've learned. So what are you teaching the babies? What about the children? Well, I have 4 tips to kind of help set the foundation of heart health for the children. You ready for them? All right, here we go. The first one, explore new fruits and vegetables. And this could work for adults as well. Explore new fruits and vegetables when you're going to the farmer's market, when you're going to the grocery store. Take the babies with you and explore, and that we'll talk about that a little bit further as well, but explore new fruits and vegetables. And research also shows that it takes 11 times to present it to a child or even a picky adult eater before they like a food. So whatever it is, you don't want to do it back to back each day, but present it to them 11 times, and then they're more likely to explore and try it. So, and even challenge them just to take one bite. Just take one bite. Make sure it tastes good, because if it doesn't taste good, now they're not going to want it anymore, and that's for an adult as well. So make sure whatever it is that it tastes good, and just take one bite. And then, you can, expand from there. So number 2, involve them in the shopping and cooking. Listen, when they are involved in the process, they have a sense of pride that they had a hand in, picking or preparing that dish. So they're going to eat it because it's like, this is my project that I helped in doing. I know with growing up, listen, my mom, not so much, but with my Aunt Mary, she involved us in every aspect of cooking. So I'll tell you, look, what my assignments were when she was making macaroni and cheese. Listen, this was when I was eating dairy and meat. But then growing up, my assignment was to shred or grate the cheese. It wasn't any bag shredded cheese. You had to do that by hand. When she was making the banana pudding and she wanted to have the meringue, your girl right here was the one beating those egg whites until they became white and fluffy with a stiff peak. And when she wanted to use pecans or pecans, however you say it, in a dessert, I was the one chopping up. And so it gave me a sense of pride, like I had a hand in doing that. So again, involve the babies. I know that, was a different example, but again, I had a hand in it. So I was, very proud to eat the food that was done. So do that with your fruits and vegetables. Allow them. I'll give another example with the babies, even the little ones. If you're preparing a meal and you're going to have a salad with it, have them clean the vegetables and dry the vegetables. If you don't have a salad spinner, have them blotted dry with a paper towel or a clean dish towel. And if you have the salad spinner, listen, they have a good time. The salad spinner that I has, you have the basket and you have the top where you press the plunger per se. Listen, have them spin until their hearts are content, so that that lettuce is dry, or that vegetable is dry, so that it adheres well to your salad dressing and make a very delicious salad. So again, those are some ways to include them or involve them in the cooking as well as shopping when you're going to the grocery store. You can make it like a field trip when you're going to there, asking them, where does this fruit originate? Listen, be creative and make it fun. The next one is getting active with them, because the inactivity, listen, even with adults, we are not as active as we can be. So make it fun, incorporating it into your activities together. So you can have dancing after dinner. There are some video games that have dancing in them, or walking after a meal. If you're not able to, if it's not conducive for you to work out outside, be creative, having fun inside the house. Sports, if they love sports, you can play basketball. Again, if you don't it's not conducive for you to be outside, you can create that inside safely, to play basketball or whatever sport that you like. But again, the key here is make it fun, be creative, and allow them to suggest or recommend what type of activity you guys do in order to be active together. And lastly, I'm going to always say, work with your healthcare provider. So working with a pediatrician, just like the questions that we included in the New Legacy Loading Part 2, when we talked about the questions to ask your doctor. Again, be proactive. You are the CEO of your health, and you're also the guardian of your children. So making sure, being proactive with them. Don't wait until there's a diagnosis of the hypertension or the high cholesterol. Be proactive, and share with the doctor the family health history, and then, having labs that are appropriate for your children, checking their blood pressure, all of those things, to be proactive so that you can make those lifestyle changes to set your babies up for a successful path to optimal heart health. So I want to mention those 4 tips again to set the foundation for heart health for the children. What about the children? So these are the 4 things that you can do. 1 is explore new fruits and vegetables, involve them in the shopping and cooking of the food, getting active together, and then lastly, working with your pediatrician. So I hope that the information that I shared today has been of value to you, and applying it, because it's not just listening, but applying those things again, so that you and your family can have that new legacy of health. And so, I always like to end with this. Remember that you are the full circle, and within you is the power to create, nurture, and transform. So until next week, walk in your power.